Ladies and gentlemen, I am Dr Hemraj Chandalia. I'll speak to you briefly today about how you should manage your diabetes when you are sick with some intercurrent illness like diarrhea, vomiting, or a low fever or high fever. So, in those situations, with the clear ideas, you can sometimes manage your diabetes at home. In certain situation, you will have to summon medical help. So I'll give you some tips in what stage you should do yourself. Now, if you have developed a diarrhea or vomiting or fever and you can't eat your meals properly, then you have to follow this particular routine called sick day routine. The most important aspect of this management is that those who are on insulin, especially type 1 diabetics or young people, they should never omit their insulin. So the concept that no food, no insulin is a totally wrong one. These people require insulin whether they eat or they don't, and sometimes that requirement is technically almost half of the insulin requirement. So if you are well controlled before you are stricken with this illness, then and the illness is not severe, you are able to retain fluids and food, then I don't think you'll have to modify a lot. But then you can almost continue your usual regime and come out quite easily. However, first of all, let me give you some general rules to follow when you are in this situation. One principle is that you have to continue your insulin and oral agents, but in a modified form. For example, type 1 diabetics will have to take insulin because no food, no insulin is a very bad policy. So they will require insulin whether they eat or they don't eat. So this is important. Type 2 diabetic, they will have to modulate also their treatment. Insulin dose may have to be reduced, may have to be increased, both are possible. And oral agents, many of them can be continued, but if the illness is severe, then they will have to be omitted, especially metformin, some sulfonylurea ureas like glimepiride or glycoside will have to be stopped, and of course SGLT2 inhibitors, newer drugs which remove the sugar through your urine, and that's how they control your diabetes. They can cause a lot of disturbance in your water and salt balance, so therefore they have to be removed. So therefore please consider that very carefully and divide your medications and insulin as much as possible. When you are sick sometimes, especially young people, type 2 diabetes, they will have to test the urine for ketones. Otherwise, normally they don't test that. In this situation, they should have those strips, and if the ketone is mild, it's quite okay not to intervene much. But ketone is moderate or very high, then they need extra insulin. And quite often they need intravenous fluids also, especially if there is some fluid loss either in vomiting or diarrhea and the fluid cannot be retained, they will require it urgently. So they should seek help immediately because the intravenous fluids will be extremely important. So you have to see whether you need extra insulin in this situation and how your oral agents should be modified, and some of them have to be stopped in the serious illness, intercurrent illness. Now, some type 2 diabetics may temporarily even need insulin in this situation to tide over this problem because insulin is through parenteral route and can be given in very small fractions while the oral agent cannot be used in that fashion. So, I think besides your insulin and oral agents, you have to be very sure to get well hydrated. So take a rehydration powder, but one which is sugar free, and have several liters at least if you already lost fluid or continue to lose fluid, especially with diarrhea. If there is vomiting also, then you definitely need intravenous fluids, and you should get medical help to start saline for you, either at home or shipped you to the hospital. So you should be ready to go to hospital for a brief period, because this way you will not get into a very complicated state and you will come out quite well within a short period of couple of days with good hydration. Remember that the cause of diarrhea, vomiting, or fever has to be tackled by your doctor with his advice. With some infection, the antibiotic will have to be introduced. So this is all very important to seek medical help of your family physician and if required, your diabetologist who can admit you in the hospital care. So caution is the word when you are sick with any illness, and you must know how to modify your treatment to some extent and take help from your family physician and your diabetologist. Thank you very much for your patient hearing.